Good afternoon, I'm Dawn Fuller. I'm an Auburn University graduate student in the nurse practitioner program. Today, I'm going to talk to you about the opioid epidemic and its impact on the healthcare system in the United States. Some of the statistics is that more than 130 people die each day from opioid overdoses. 60 million people annually obtain prescriptions for opioids. There are an estimated 10.3 million Americans above the age of 12 that misuse opioids in the year 2018. Research has shown that in the year 2017, 47,600 patients in the United States died of opioid overdoses. Research has also shown that in the year 2015, the financial burden to the United States government due to the opioid crisis was $504 billion. Opioid is given in appropriate doses to reduce the effects of pain. Exposure to opioids always creates opportunities for long-term abuse and misuse. Opioids trigger the release of endorphins, which is the brain's feel-good neurotransmitters. Endorphins stifle the patient's perception of pain and creates the feeling of pleasure. The release of endorphins create a temporary sense of well-being. When this feel-good pain wears off, the patient might think or believe they need more medication in order to feel better. Over time, the same dose of opioids stops triggering the strong flood of good feeling because the body slows down its production of endorphins. Users then need to increase drug doses so that they can continue to feel good. There are several risk factors for opioid abuse, including unemployment, poverty, family history of substance abuse, prior history of substance abuse, and criminal histories. Research has also shown that women have a prior tendency to be addicted to opioids more than men. The general public has not yet realized that stakeholders involved in the opioid epidemic is not specific to one population. The stakeholders in the epidemic may include any of the following: the federal government, state governments, legislators, physicians, pharmaceutical companies, law enforcement personnel, teachers, parents, students, healthcare workers, and a multitude of the general population. There are several proposed resolutions. The CDC has proposed the following to assist in resolving the opioid epidemic by advancing healthcare education and screening patients for opioid disorders by understanding the societal and physical risk factors for vulnerable patients, by prescribing appropriately, including prescription drug monitoring programs using evidence-based guidelines, by communicating with patients about pain management alternatives and the risk of the use of non-opioid treatments, by the effectiveness of naloxone and substance abuse treatment options, including medication assistance treatment, by distributing kits and training physicians and first responders on the administration of naloxone, understanding and addressing bias and stigma that the epidemic affects the people of all ages, races, and socioeconomic backgrounds, and some caregivers have mistaken ideas about what an addict looks like. There are several other resolutions that can be explored and are listed below that the Centers of Disease Control have decided on, and there are 5 approaches to the epidemic control, which are to conduct specific surveillance and research identifying the specific opioids which are most readily abused, to build state and local capacities to fight the crisis in 50 states and 16 localities funded by the CDC to track the number in which the state and come up with prevention programs. The CDC would like to partner with healthcare providers and healthcare systems control the opioid prescriptions guidelines on an evidence-based practice system. They would like to provide community-based programs with partners with public safety workers, firefighters, law enforcement, DEA, and enable the CDC to identify individuals who might be at high risk and refer them to effective treatment programs and lessen the harm of opioid overdoses. And they would like to empower consumers to make safe choices when it comes to opioid use. These programs are funded by the federal government in the amount of $485 million over the next 2 years. There are a lot of resources needed to take care of these programs, which include federal funding, state funding, healthcare support, pharmaceutical company support, law enforcement support, community support, and strict adherence to evidence-based guidelines. These are my resources. I hope you've enjoyed this presentation today. Thank you very much.